Good morning, Dr. Mindy here. I wanted to do a video on vertigo. So this is something that there's a decent amount of people come into my practice and they tell me that they chronically experience vertigo. It comes, it goes, it's not there all the time. But I want to talk about some maybe little known causes that could be contributing to your vertigo. So number one is a kidney issue. When the kidneys are insufficiently functioning, this affects our blood pressure. And the kidneys, I have found in many scans, are a direct link to a vertigo condition. Another issue that I see is that we have little crystals inside of our inner ear, and this is what helps with our equilibrium and our balance. And sometimes these little crystals get malaligned or kind of off kilter, and this can cause vertigo. Some things that can cause these crystals to move out of place are a car accident, like whiplash. When your head is whipping, think about having like some tiny little pebbles in a little glass vial and you whip it, right? So they're going to jump around. If you have slam on your brakes at a stop sign, people who listen to headphones or ear pods too loud, this can disrupt the crystalline balance on the inner ear. Sometimes, rarely, even ozone therapy. When I am floating, doing an ear insufflation, and this gas is going through the ear, sometimes it's very rare, but it can disrupt those little crystal balances as well. Sometimes it can be a neck vertebrae that's out of alignment. But the kidneys and some kind of trauma or abrupt movement to the head or the neck is what I see the most often. In addition to the ear pod, something that you're forcing directly into your ear. What I recommend for my clients to try first is I get them in for a scan so that we can take a look at their kidneys. But when they message me and they're at home, I tell them to try what's called the Epley maneuver, E-P-L-E-Y. And this is a maneuver that you can do at home. You can Google it. There's YouTube videos on it. There's also written out instructions step by step. But this is a maneuver that you can do at home to reset these crystals inside the inner ear. I have used this on myself probably 8 or 9 years ago. I had a bout of vertigo which came out of nowhere, and it's terrifying. I can now relate to the people that come into my office that have this issue because I've experienced it as well. It's debilitating, it's scary, but I did the Epley maneuver and it resolved it within probably 3 to 5 minutes. So if you're someone who suffers vertigo, look it up, learn to do it before your next episode, because when you're experiencing vertigo, it's hard to read.